All right, let's move on to question number three. This one's on adults. This one's interesting. I am an adult male in my 30s. I've had SM as a child from ages 3 to 7. Eventually, I got over it through some therapy and medication. As an adult, I'm functional. I have a job. I can speak to others. I'm overall independent. However, it hasn't always been smooth. I'm still very shy. I have anxiety and depression. I tend to isolate myself a lot and have trouble maintaining friendships and relationships. I really recently started seeing a therapist, which helps. I'm sure there are many like me who had SM as a kid, but still have lingering issues as an adult. Do you have any advice on how I can deal with my current situation?
This is a great question, and we do get similar questions. A few things. Number one, I'd want to understand what issues mean. I'm assuming social communication confidence here, the
Mhm.
ability to be confident in social interaction. You said that you have difficulty kind of maintaining friendships and relationships. I'd want to know, do you feel that you can read social cues well and understand the nonverbal language of communication? Sometimes that's difficult. I'm not saying by any means this is the case, but are there other comorbid or other challenges you may be having other than having a timid temperament? We do see individuals that have autism spectrum. I'm not saying that's what you have by any means, but inability to read social cues well and social language and things like that. So if that's playing a role, definitely working on that with the therapist or somebody that has expertise in that would be something to consider. Some adults I work with have difficulty with some of the other whys. They may have difficulty with processing language. They may have difficulty expressing themselves verbally. So again, I don't know if any of that's coming into play. I'm going to assume it's social communication confidence and that when you're comfortable, you have appropriate social skills. So to me, it's probably lacking in confidence. What I do with adults is we want to really navigate a social communication opportunity. So some of that would be, where am I going? Who's going to be there? What can they ask? What would be my answer? What can I ask? And really beginning to navigate social communication situations. When it comes to maintaining friends and relationships, I think that's a whole kind of separate topic because I'd want to understand what is getting in the way with that. Because if you have appropriate skills and once you're comfortable, your confidence is there, then I'm not sure what else may be going on that's affecting your relationships that are, maintaining friendships and relationships. So I would, as a clinician, want to dive into that a little bit more. And it's really difficult to answer that. But opportunities in terms of social communication in lots of different situations will certainly help. I talked about action plans, predicting questions that can be asked. We talked about greetings, maybe that we can think about and kind of taking your anxieties and worries and fears and kind of breaking them apart. What is it specifically you're anxious about? And then kind of diving into that a little bit deeper and figuring that out. And then kind of tease it, like I said, teasing it apart and really working through it. Because this
Yeah.
is kind of like a really open ended question. Issues to me, assuming our social communication confidence. So, how can we build that confidence? And that's practicing communication opportunities and
Yeah.
sometimes in a very kind of navigation way of knowing what, when, where, and how, and questions off questions and so forth. And again, these are things we work on with adults all the time. So
Mhm.
definitely speak to your therapist about navigating the kind of a social communication interaction, whether it's with people you're not as comfortable with, like in stores and restaurants, predicting those common questions, going through the kind of map, a
Mhm.
hostess, a waitress, asking for things, initiating in these situations with aunts, uncles, relatives, things like that, kind of coming up with what types of questions are people going to ask you? What could you ask them? What is it going on in their life? Is there a holiday? Is there a skill they have? Is there something unique that you can ask them about? Again, this we can do hours on this question. It's really about figuring out how to navigate through social communication interactions.
I think what you said in the last question, question number two, is actually relevant here as well. It's going to areas of your interest, right? So if this person maybe has a job they don't love, I'm just assuming they're working a job every day. Maybe they find a, maybe it's working out or maybe it's chess. It could be anything, obviously. If they start surrounding themselves with people that are also interested in those activities, That might help with their confidence, right? And these issues that they're mentioning.
Yeah, for sure. And then definitely if they have confidence in that skill, that's a wonderful area. I think the thing that stands out the most to me with this particular question is I have trouble maintaining friendships and relationships.
Hmm.
So I want to really encourage this individual to kind of seek out why that's occurring. In other words, once you're comfortable, once you're with them, like we can set up the world in terms of finding your areas of interest. You have confidence in that area of interest, but if it's and navigating through a social communication opportunity, but that's just the start.
Hmm.
Once you're there and your anxiety is lower and you can verbalize, do you get comfortable enough to have free flowing back and forth, give take of communication and conversation?
Yeah.
And if that's
Let's
held up either through lack of understanding the nuances of social language, the kind of the social puzzle that's difficult to figure out, that will impact relationships. And I just feel that, yes, we can help set you up with kind of the map. But once you're there and you're able to talk and you're able to kind of understand the conversation of what would be logically next, it's the nuances, it's the subtleties, it's the unpredictabilities. And if
Yeah.
that's a challenge, you definitely need to talk to your therapist about why that particularly is a challenge.